This is Tanya, and today we're going to review infection control. So first, when we look at infection control, what are we doing? So basically, infection control practices in the medical office is to help prevent the spread of infection. And so we need to understand a couple of these things to be able to help prevent that spread. So first, understanding a disease, and that is when somebody has a definite pathological process, having a distinctive set of symptoms and a course of progression. So a disease is something that somebody has going on. The provider is going to look at that and then make a diagnosis. Medical asepsis, that's a really important key term that you're going to need to know. Those are the practices that we use to help prevent the spread of infection. Medical asepsis is what we think of as clean technique. The number one thing that we do with medical asepsis is washing our hands. All right, to have infection control, we have to understand there's microorganisms. Microorganisms are, you can't see with the naked eye, they're present everywhere in the environment. They are in your body as well, they're on your skin. So, microorganisms are everywhere. But the microorganisms that cause disease are called pathogens. So they are disease-producing microorganisms. Now, when we have an infection, it's when these disease-producing microorganisms kind of overrun the normal flora and things in our body. So, microorganisms. So like I said, they're everywhere, but we have natural defenses against pathogens. Our unbroken skin is a natural defense. We have saliva that can be a natural defense. Our tears rinse out anything. We have, again, eyelashes, or there's hair pretty much anywhere in your body that help trap and help contain these pathogens. Your GI tract, our stomach acid, can break down and kill pathogens. So a lot of things that you eat might have different types of pathogens in the food, but when you eat it, the stomach acid will break it down. For example, a lot of times sushi, when you have real sushi that's the raw fish, sometimes there's little worms in there, but these worms really don't bother you because the stomach acid can kill them. Your GU tract, so the acidic urination, will flush that out. Okay, and you'll see that especially for males, they can transmit yeast infections to a female, but for them, they typically don't get the yeast infection because they have that one-way track in and out. So as they urinate, it flushes out that yeast infection. And then, of course, your respiratory tract, you have, again, the cilia, the little hairs that trap. You have secretions, so we cough, we sneeze, we build up mucus. This helps spread or get rid of the pathogens. All right, so here's just some basic terms. Transient flora. So these are microorganisms that do not normally reside in a given area. So they may or may not produce disease, but they're moving around. Like I said, we have normal bacteria, normal flora in our body that helps with our normal body systems. But sometimes you can have these transient ones, and they may or may not cause the disease. Resistance, that's just your body's immune response to prevent infections by the invading pathogens. And virulent, that is something that's highly pathogenic and disease producing. All right, so that is a microorganism, or what we consider as a pathogen. So pathogens prefer a certain environment to grow, and that environment is a warm, dark, moist environment that has a food supply. And really your body is that perfect place for a pathogen to grow because you have moisture, it's warm, not too warm, and you have a whole bunch of nutrients. So things that they don't like, typically bright light, the dryness, obviously clean, or fevers, right, that will destroy a lot of pathogens. And then there's certain types of pathogens. You have aerobes and anaerobes. So aerobes like oxygen, and anaerobes don't require any oxygen. So again, this is just pointing out aerobes. Those are microorganisms that require oxygen to live and produce, and anaerobes, bacteria that do not need oxygen. So those are just two terms that you really should be aware of. The chain of infection. The chain of infection, when you have all of these links together, you end up having a chain of infection. So you have your infectious agent, which is your pathogen. It can be bacteria, virus, fungi, protozoa, parasite. So these are the things that cause the infection. Reservoir can be a place where that infection is hanging out, waiting to infect somebody. You have your susceptible hosts. So this is the person that has the infection, okay? And anybody can be a susceptible host. Then you have your portal of exit. So this is how that pathogen is getting out of the body. And there's numerous ways that it can go out of the body through your respiratory tract. So you can cough, sneeze, even talking, through your GI tract, whether it's going through stool, vomit. Portal of exit could be through a broken skin, coming out that way. It could be through your reproductive tract, where you're sharing it mother to baby or with a partner. So portal of exit, remember, is how it's getting out of the body. Mode of transmission is how it's going from point A to point B. So how is it leaving one person and getting to the next one? And so there's different methods or modes of transmission. You have contact, that's from person to person, or it could be indirect, from person to a contaminated object to a person. Droplet, coughing, sneezing, talking. Airborne, this is where it's going to linger in the air and somebody's going to breathe it in. Now vector-borne, vector is transmitted through a vector, and vector is an insect or considered a rodent that's going to transmit it that way. And then another mode of transmission, which is not listed on here, blood-borne pathogens. And that's really where you're going from an opened area, blood comes out, somebody comes in contact with that blood, and then they expose it to another portal of entry. And so that brings us to the other chain of this infection is portal of entry. And these are ways that it can get into the body. So your respiratory tract, your GI tract, mucous membranes, the broken skin. So these are all different ways that we'll get into it. All right, and remember the number one thing that we can do to break this chain of infection, medical asepsis, washing our hands. Okay, so here it's just talking a little bit more about the modes of transmission. So direct transmission, that's basically going from person to person. So you're taking it from one person to another. And then you have indirect, and that's where it's going from a person to a contaminated object. That fancy term for a contaminated object is called a fomite, and it can be on that surface for a while, and then somebody else comes along and touches it and either ingests it, scratches an open wound, or whatever the case may be. So that's indirect. This is just kind of some common communicable diseases and their methods of transmission. So you can kind of look this over so you can be somewhat familiar with all the different types of precautions that there are. Okay, there are government agencies that do help oversee infection control, particularly for the medical office. So two of those, you have OSHA, which is the Occupational Safety and Health Administration, and they are for actually all employees. And so they're a federal agency that oversees working conditions, making sure employees have proper working equipment, safety measures. And again, this is for all employees. So if you were to work at a construction company, OSHA would say, hey, you have to have ladders that are functioning, that aren't broken, maybe hard hats, whatever the case may be. And they do the same for your healthcare provider's office saying you need to have all the necessary tools in place if you're working and you're going to be exposed to different things. Then you have the Centers for Disease Control and Prevention, the CDC, and this is another federal agency that is all about public health and safety. And I'm sure we all are aware of the CDC as it has been in the forefront during this whole pandemic time. So again, here's medical asepsis, and it's very important that you know medical asepsis. Again, it's clean technique. So these are the practices we use to help prevent the spread of infection between people, objects, everything. And you are going to be using this all the time. The number one thing that we do with medical asepsis is washing our hands. Okay, that's the most important thing. Other things that we do with medical asepsis, wiping down surfaces in between patients. You should be wiping off the stethoscope if it's touching somebody. You should be cleaning the blood pressure cuff and machine in between patients. So again, it's all clean technique, right, when we're referring to medical asepsis. All right, so there's different levels of infection control. We have sterilization. And so sterilization, that's the highest level of infection control because it destroys all microorganisms, including spores, right, on inanimate objects. Obviously, you can't sterilize your hands. You can wear sterile gloves, but you can't sterilize them. So sterilization, we actually think of as asepsis. So medical asepsis is clean technique, aseptic technique, absence of disease-producing microorganisms without germs is a simple way to remember, is sterilization. Okay. And then you have disinfection. So that's where we're killing a lot of things, but not everything. So you can use disinfectants, and we have things like germicides, which will kill most of the pathogenic microorganisms, but it will not kill spores. And then you have sanitization. When you're sanitizing, this is the lowest level of infection control. It's going to clean off pretty much the visible contaminants, using soap and water and friction and things like that. So this is the lowest level. Right. So again, sanitizing, it's where you're going to clean off the visible contaminants of your hands, soap, water, friction. So you really need to do this first before you disinfect or sterilize. If there's objects on something, so if you're reusing a piece of equipment, and you can see tissue, you can see some sort of debridement, it needs to be washed and cleaned off. Disinfection, so again, this is where we're talking about like germicides, things like that. We're killing off a lot of the stuff, but it does not kill the spores. Okay, so kind of remember that. When you're using disinfectants too, you should also know like there might be a time frame, how long a disinfectant actually has to stay on a surface before it actually works. If there's a temperature involvement and things like that. Sometimes people just spray things down, wipe it off, and you're really not disinfecting because it hasn't had time to take effect. So you should be aware of the equipment that you're using, the cleaners and such, and what needs to be done if there's time frame and all of that. All right, so infection control for the medical office. Again, this is regulated by OSHA, the Occupational Safety Health Administration. Every office should have policies for the employees and OSHA representatives, so that people come, they're going to look, you should have that all there. Employees' health and safety needs to be put into a policy for an exposure, infection control exposure plan. So all of this needs to be in writing so you know what to do in case you are exposed. So every office needs to have an exposure control plan. There will be a potential for you to come in contact with blood and body fluids, which are biohazardous materials. So exposure risk factors simply means conditions that tend to put employees at risk for contact with these biohazard agents, such as bloodborne pathogens. OSHA requires that any offices that have 10 or more employees must have a control plan, a written plan of action in case something happens. For example, medical assistants, you will have access to blood and body fluids. You will have the potential for exposure. So you need to know what to do if you have an exposure incident in the office. So what kind of equipment and supplies do they have? Let's say you get something sprayed in your face and your eye. You have an eye wash station. If you get stuck by a needle, what are the protocols there? Hep B vaccines and things like that. This all needs to be clearly written out for the office so you know what to do in case of an emergency. So for infection control for the medical office, we're continuing with that. Some basic terms and things that you have to be aware of. Personal protective equipment, PPE. Those are things that are used to protect you from exposure to blood and body fluids. So gloves, face mask, gown. These are all things that, remember, are to personally protect you. When you are wearing these things, it's not so much about protecting the patient, it's about protecting yourself. Immunizations, those help protect you, create an immune response to specific diseases. You'll have to go with your facility's policies about what type of immunizations they do want you to have. An exposure control plan, that's the written plan by OSHA that says, okay, if something was to happen, this is what we need to do, and then hopefully to prevent from further infection. Biohazardous, that's describing a substance that is a risk to health of living organisms. Usually these are blood and body fluids. And then post-exposure testing, these are lab tests that might be performed after a person comes in contact with a biohazard. So that's something that might be required based on your exposure control plan. So what do you do if you have an exposure? Well, if an exposure occurs at your facility, obviously you're going to go with your facility's requirements, all right? Generally, these are the rules. You're going to apply first aid, all right? So first thing that we're going to do if you're bleeding, control the bleeding. Now, if you had a needle stick, you're going to actually bleed it out for a little bit and you're going to wash the area, all right? So if you got stuck in the finger with a used needle, you're going to milk that finger, bleed it a little bit while you're washing your hands. And you'll have to refer to the OSHA bloodborne pathogen for a needle stick injury, but I believe it's 10 minutes that you're going to wash. Again, go with your facility's policy. And then what you'll do is you'll notify your supervisor, you'll probably fill out an incident report, and then they'll determine if you're doing post-exposure testing and what type of follow-up care. And then you're going to do the OSHA 300 log. This is where you're going to record the exposure. Excuse me, you need to do this if the loss of consciousness, you have to be transferred to another job, resulted in need for medical treatment, or it caused conversion of negative blood test to positive for disease exposure. So there's a potential. So if you were Hep B negative before and then after, you become Hep B positive. But you will have to go with your facility policy, but understand it's the OSHA 300 log when you've had an exposure. Here is a copy of the OSHA's 300 for work-related injuries and illnesses. Standard precautions. So standard precautions, if there's a potential of coming in contact with blood and body fluids, we look at all blood and body fluids as being potentially infectious. So we're going to make sure that we're going to wear the proper PPE, okay? And we're going to do this for everybody. If I think I'm going to come in contact with anybody's blood, anybody's body fluid, I'm going to wear the proper gloves, gowns, mask, or whatever it might be. So again, personal protective equipment, just want to reinforce all of this, gloves, gowns, anything, gloves, if the potential of coming into contact with any blood or body fluid, you want to make sure you have the proper PPE. Remember, your employers are supposed to make this equipment available for you. If they don't, they are not compliant with OSHA and they can face significant fines. Now, it also comes down for you guys to make sure when you are working in a medical office that you are handling the equipment properly. If your employer provides you with PPE but you don't use it properly, or you don't use it at all, you are actually in violation. So if you wear the same pair of gloves between 2 or 3 patients, you are at fault. Gloves should always come off right after patient contact, and you should wash your hands. That being said, now we go into environmental contamination. If there's spills or blood, you should have the cleaning kit. All right, if there's blood, your facility should have that. Sharps containers, shoe coverings if there's a potential of blood on the floor and a lot of urine or things like that, depending on where you work. Linens, making sure that you are changing linens, or that paper drape that goes across the exam table in between. So if any of this is contaminated, you need to know, where does this stuff go? A lot of your places will have red bags, biohazard bags, and if things are contaminated with body fluids, they will go in there. Some things can go into the regular trash, or they'll need sharps containers. So make sure that you understand what you need to do based on there are FDA and OSHA policies. So again, biohazard waste, that's anything with blood or body fluids. If it's saturated, has to be kept in a certain red bag with the biohazard symbol. And you understand that a lot of your offices are paying for all this stuff. So make sure you put things in the appropriate container. For example, sharps containers should only contain sharps. There should not be gloves, there should not be gauze, cotton balls, any of that sort, because your provider's paying for sharps to go into a sharps container. So make sure you are putting things where you need to and that you're doing it appropriately. Hep B. Hep B is the most concerning thing that we have to worry about as far as bloodborne pathogens. Hepatitis B can live for more than a week on a surface. So this one is that we're more concerned compared to HIV. HIV dies almost instantly out of the body. So hepatitis B is more concerning because, like I said, it can live, right? So you need to be aware and just mindful when you're touching different surfaces to do proper hand hygiene, okay, in between patients all the time. And again, we remember our standard precautions. If there's a potential of coming in contact with blood or body fluids, we want to make sure we have the proper PPE. This is where the Hep B, it is killed with that 1 to 10 bleach solution. Excuse me, there is a vaccine for that, and so you should have your healthcare vaccine. There are some who can waive that. It just depends on your facility. So here, the Hep B vaccine, it's a series of 3 injections. Usually you get 1, then 2 months later, and then at 6 months. Okay, and just realize it may only last 10 years. So if you had it at birth, it might not, be good any longer. So typical HIV or Hep B exposure, what typically happens, and it can vary with your facility, you get an immediate blood test, then they might retest at 3 months, 6 months. So you'll have to go with your facility policy and how often they want you to test. So this is just some basic overview of infection control. So I want you to just take time to go through, understand the different classifications of disinfection, sanitization, sterilization, medical asepsis, the clean technique that we use, and just understanding what you can do to help prevent the spread of infection.